I would be lying if I said that I could live my life without you.
Wipes up.
'Cause even though
I don't know. What is the car score today?
0.2.
0.2. Let me ask the author of the car score here. Dr. Felix Cabrera, the Chief Medical Officer for Public Health. Doc, is it possible for the car score to go to 0.0? Is it mathematically possible? I don't know. I'm asking.
Yeah, it is. Absolutely. It's basically three main values that are multiplied against each other. And if one of them is 0, then car score could go down to 0.
Has it gone down to 0 yet?
No, the lowest we've ever been is 0.1.
Ooh, so this is 0.2 is not even the lowest.
It's been 0.1 a couple times now.
Right. Yeah. I don't know.
And then, more recently, right around us going to peak for 3, we were at 0.1. Right. The last time we were at 0.1 was in August, end of July 20, when the last time peak for 3 was declared back in July. And our car score at that time was 0.1.
So we weren't using the car score formula at that time. So did you just go back and calculate it?
Correct. It was just a retrospective view.
Oh, that's cool. Did you release that? Like just the numbers of the car score going back from the start of the pandemic?
They were in one of the graphs that I've shared. I think even on KUAM as well, where there's just a whole trending that goes all the way back to the beginning of the pandemic. Actually,
you share so many graphs, Doc. I lose track sometimes.
Yeah, can share it again.
So, are you hungover this morning, or?
Oh.
I don't know if you were at the bar or the fundraiser. Not probably neither.
Either.
Okay.
I was home.
Right on. Hi, Janela. Good morning.
Hi, good morning, Chris, and good morning, Breen. Good morning, Jason.
Good morning.
Right on. I guess, Doc, we'll just start with everybody keeps asking about the variant, and I know that we sent it off, and we're waiting for the CDC to run the genome sequencing or whatever. Have we heard back from the CDC yet? And if not, what's the timeline?
Yeah, the only thing we've heard back was just a couple of days ago. They sent an email basically saying, sorry, tests are still in the queue, so to speak, and that they will be run, in short order. But we don't know expected timeline. We expect it this week, but again, still nothing, no word as of this morning.
So let me just ask you, because honest, TBH, I haven't really checked the national news lately about the variant. So what's the status of the spread of the variant, not just in the continental U.S., but I guess around the world?
Yeah, so, one of the key concerns, one thing we know is that the UK variant is spreading quite rapidly to the entire United States. What's actually even more concerning is the recent discovery of a California variant that is basically a triple threat, so to speak. One is that it looks like, and this was first identified in going back and looking at samples all the way back to September, and then it's become the predominant strain in California. Well, basically, it's one that it spreads more rapidly. Number two is that it may evade antibodies created by both the vaccine and and natural immunity, but to what degree we don't know yet. And then the number three is that it likely will make you more sick overall. You have the higher chance. So it's still very early data, very early recognition, and they're still studying a lot more. But already seeing all three of that at the beginning is something that's a big concern. Now, for example, the UK variant, at first they thought it was just more, that it just spread more rapidly. But now they're finding that it actually is has a higher risk of more, morbidity and mortality. So that's a concern. So we're watching that very closely. It's very likely that this California variant, if it's been around since September, that it may have been here on Guam at some point, and it may have contributed to what we went through in August, September, October, November. Wow. And so that remains to be seen. But that's why we did send samples that go back all the way even to November, and it's a whole genome sequencing. So we'll know what these what these viruses are. And as more variants maybe get recognized, we can compare against them and then see where we're at. So still a lot of information that we'll be getting out of both our samples and what the studies say from this new California variant. God forbid it combines with the UK variant and then becomes even more difficult virus to combat. But bottom line is that's why quarantine is so important coming into Guam.
Yeah, I just Googled it here, Doc. There's an article in the New York Times, and there's a virologist at the at UCSF who says, "I wish I had better news to give you that this variant is not significant at all, but unfortunately, we just follow the science." So they pretty much say everything you had just said. But when you talk about this variant being around, or they tracked it, it said it was first discovered in California in December. Do you think that this is an issue moving forward for us? Because it sounds pretty scary that it's mutated to a point where vaccines may not be effective against it.
Yeah, and so just to be clear, what they're seeing is that it maybe decreases the effectiveness by about half, potentially. Whereas, like you look at like the South African variant, where it decreases it down to 1/6. And so that's a big difference, right? And so it doesn't look like it's as bad as the South African strain, for example. But again, they want to understand this a lot better. And so yeah, I'm just looking back here. It was samples that they looked at between September through January, and then that's where they. But I can't find here where it became the predominant strain in California. Later on through their biggest waves toward the end of last year.
Right. I know that. Oh, I got a comment here, and a lot of people are. I think I sent you a message along these lines yesterday. Mary Duenas Matanani comments in our Facebook live feed. I am returning home soon. I have been fully vaccinated. Do I still have to quarantine when I get back in early March?
Yes. There's no change to the quarantine requirement, whether or not you've been vaccinated this time. And as you can see, especially with the new discoveries of strains like this of concern, which is why we're still being extremely vigilant with our traveler quarantine program.
Doc, I wanted to, and I don't know if Janela wants to chime in on this. Do we have that video of the Bayview? We got a video from a patient at the ISOFAC at the Bayview. I don't know how old this, she's actually in there now, but she sent a video of, what was it? Was it roaches or ants? Termites or something. Anyway, I know you guys had said there was an insect problem at the Bayview. So just pop that up on the feed. And then I remember that you also had said at some point that we were going to be moving the ISOFAC out of the Bayview and to another facility. Obviously, that hasn't happened yet. What's the timeline on that? And I guess what would you say to this lady? I know her, she's a friend of mine. She's actually pretty sick in the ISOFAC. But what would you say to those people who are in that ISOFAC? I mean, I know it's bugs. We're tropical climate, obviously, but the ISOFAC, isn't it supposed to be a semi kind of sterile, like quasi-medical environment for people who have tested positive for COVID? Is this a Janela question?
Yeah, right.
Okay.
Yeah.
Good morning, Janela.
Good morning. Yeah, thanks for that. And I haven't seen this video that you're referring to.
Let me send it to you.
Yeah, but you're right. It is something that we have discussing and looking into, looking for a different facility for our isolation unit. We haven't had a lot of positive cases in our isolation unit, so we're looking at a different isolation facility. Maybe even possibly looking at using merging or using floors at Dusit. So that's an option that we've been discussing as well, because we haven't had a lot of positive cases. So the use of an entire hotel where we only have a few rooms that we're using just doesn't seem like a good use of our resources at this time. So that's still in discussion, but we do realize and recognize that there have been a lot of complaints about ants and bugs, and now I'm hearing about termites. I haven't seen this video yet. So, but yeah, if you can send it to me, I really appreciate it.
Or I think Jason did, right? Doc, I wanted to go back to you if we could. And I know there was discussion at the public health oversight hearing and again on this show a few different times about the variant and the importance of quarantine and the discussion was that we're going to start refining and narrowing who are critical service workers. Is that what they? Yeah, basically, we're going to go through the quarantine exemptions and narrow that list down. I know that I think you had said that, and Director San Augustine had said that. Where are we with that? And who's going to no longer be exempted from quarantine?
Well, that's not a. It was more of a general statement in terms of being a little bit more critical about reviewing them and ensuring that these that these requests really do meet what we consider as a critical service worker, for example, or an essential health professional. So that review has been so far what we've had have been pretty straightforward. Like, yes, you are essential. Yes, you are critical. And so, but the way that we tighten this up is several items here, and I think it's okay to start discussing this because these are discussions now. They're not completely final, but we're looking at moving toward this. One is, first of all, is that 5-day window to when, if you're a critical service worker or a healthcare professional, right now you're required to have a negative test 5 days prior to arrival to Guam. Now, if we remember, back when we were making this a requirement, we used 5 days instead of 72 hours because it was so hard to get a test, especially stateside. But that's not the case anymore. Now it's actually much easier to get a test, and so because of that, we want to tighten that down and bring it down to the 72 hours, so that we can have a better sense of somebody being potentially positive and then not be able to travel and catch them at that point. So that's number one. Number two is also in terms of increasing the frequency and the checks on these persons when they have restriction of movement, meaning they're still in quarantine at home. They're only allowed to go to work and then come straight back. But then increase the compliance checks, not just at home, but even at their workplace as well. Show up there randomly, ensure that they're there, and ensure that their employer or sponsor is also participating in the responsibility of ensuring that they are, that they are practicing all mitigation, efforts and needs. So that's the other part there. And then a third component is doing surveillance on them overall in terms of testing them after they arrive at some point. And so these are the discussions right now. But the testing after actually is something that we're moving on. Pretty much starting today, I think is when they're going to start trying to test them at day 5 after they arrive. Now, again, this is not like to test them out of anything. It's just for surveillance because they've been already here. They're doing their critical and essential work, but we want to ensure that even if they're not having symptoms, that we just do a test just to be sure.
So you're not saying that we're going to eliminate whole categories from the exemption list. We're just going to look closer at the applications and requests for exemption that are coming in.
Correct.
Okay. Correct. Janela, how did the bars go last night? Were you guys out and about? Did you hear anything? Any inspections?
We did. We actually went out last night. We visited a couple bars.
Hold on, you went out or you went out?
No. Not me.
Okay.
I didn't go out.
Okay.
I was actually working. I was busy working. So our inspectors went out and they visited a couple bars, but did not observe any COVID-19 violations. So we're happy to report that everybody was in compliance. So no violations observed. Everybody was happy. I think, the bars were well prepared for this. There was enough ample time to prepare for bars reopening. They had the guidance in hand. And I think it's, they were waiting for this to happen. It's been a long time since bars have reopened. And I think, when you really want something to happen and you have a goal set in mind and you know that you have safety, sanitation in mind, and you just really want to protect people, we can achieve that goal. So no violations observed.
I remember we had, I don't know if it was you or someone else from the department, but talking about fundraisers, right? And at the bars, There was something that was said about fundraisers. Are people okay to have fundraisers now? And if so, or if not, what kind of parameters do they have to adhere to?
I believe the guidance does contemplate fundraisers, but it's the same thing. I mean, as long as we're following the guidance, as long as the minimum requirements are being met, right? There's no difference in what we're doing in terms of the fundraiser, whether you're going to a bar for a fundraiser, going to a bar to mingle with your friends. So what the event is for, if it's for a birthday or an anniversary, I don't think there's a difference in what you're going there for, as long as we're all following the minimum requirements for the event. So, the guidelines are established. So we're following sanitation requirements, signage, postage, hand sanitizing, mask wearing, then I think we're okay.
Janelle, I remember now. So you can have fundraisers, but what you can't do is bring food from
Right,
home, right? And have it be
right.
self-serve. It has to be in like lunch plates or something, right?
Grab and go, something like,
Right.
right,
Okay.
grab. Well, I mean, you're not supposed to be eating your food at the establishment. And so I know some places that have done that, where you serve the food in like a to-go pack,
Hmm.
and you're not eating it there. So as long as there's no food being eaten at an establishment.
Right. Do you know? I mean, this is kind of weird, but I wanted to ask: is there protocol for like strip clubs?
Um, I believe that there has to be some kind of barrier in place. So there's no, physical touching of the dancers. But that's my understanding, is there's a barrier in place, and it has to be just like it says in the guidance, minimum of 6 feet from the horizontal edge. Um, so it's in the guidance. It's pretty much the same thing.
As
You're talking about for the actual dance floor, right?
right.
So it's kind of similar to the live entertainment.
Mm,
Um, so as long as there's a physical barrier that's established, a minimum of 6 feet distance, and there's no physical touching.
but there you go,
Just
Jason. Sorry, Jason wanted me to ask. Yeah, so it's basically like the singers in the
I thought it
band.
was.
They got to be up behind the plexiglass that's 6 feet high. Okay. All right. There you go. That settles that. Doc, I'm sorry. I had to ask. You got to ask the tough questions in this. That's why I'm here. Doc, what about Pcor 3? And again, I just want to go back to, we went into Pcor 3 before, and then we saw this crazy surge. Being that this is kind of like the second go round, did we look at what like caused the surge and maybe like kind of tighten down or any like gaps or whatever that could be areas of concern?
Yeah. So we have to learn from our history, right? And so taking a quick look back at what happened last summer. So at mid-June was actually when bars were allowed to reopen back in 2020, and allowed to reopen at a 50% capacity. A month later, the governor declared Pcor 3 on the day before Liberation Day, and on July 20th. But what also happened was toward the end of July was a change in our quarantine protocol. And that's when we were using an earlier version of the CAR score to determine low risk areas. And these low risk areas were able to come in without having to meet quarantine or testing prior to arrival. At that time, Hawaii was considered one of the low risk areas. But what we saw was that several people were, overnighting in Hawaii and then claiming Hawaii as their point of origin, for example, when they actually just came from Texas and California, which were very much high risk areas. And so it was likely holes in that led to the introduction of more imported COVID cases, and thus really rampant community spread after that. We did see some cases of bar outbreaks, and then some bars were closed early on, even before the governor declare P41 once the surge started really happening, started really going up in August, early August. So we have to remember that those were the different parts there. So it wasn't like bars caused the big spread. You know, we're acknowledging that. They did have their own clusters, but that's why my main point again here is the reason why we're able to be in P-Core 3 and the reason why what we need to do to continue to be in this state so that we can enjoy this level of less mitigation is firm control of our traveler quarantine program, and that we actually tighten things up rather than loosening them. And so we thought we were tightening it up and loosening it in the right areas back in July, end of July, but in hindsight, that didn't work. And so now we are very much more vigilant, and that's why you keep hearing me coming back to talking about traveler-based quarantine, because it's what makes us, it's what keeps community spread, to an extreme minimum here at this point.
Doc, could you clarify there's an announcement from the Gov about 30,000 vaccine allotments for March. Is that just for March, or is it for every month thereafter? And where are we in meeting the herd immunity by Liberation Day?
Yeah, so right now as we are, so part of that, it's actually total is close to 35,000 that we're going to get at the end of the first week of March is when we expect it to arrive. And so, but the way that they're accounting for it is like part of that is like an inclusion in our February allotment that just got added on. But that being said, if you look at February to March, there's about a 50% increase in the amount of vaccine that they're giving us. And so we expect that they're going to continue to increase our monthly allotment. So for our monthly allotment for March is around 32,000. We expect that to be higher for April, and then we expect it to be higher for May. And so based on that, we are going to be moving in the right direction. And we were very early saying that that basically the vaccine supply is our rate limiting step. It looks like with a lot of lobbying with the feds and really pleading our case that they've heard us and they're accommodating our requests. And so we look pretty good in terms of vaccine supply moving toward July 21st for trying to achieve some form of herd immunity before Liberation Day. Now, that being said, there's a big game changer in this, and that's Johnson & Johnson. So just recently, the FDA has did their preliminary review, and the review is specifically just for safety. And so far, they feel that it met all the safety measures that they placed originally. So that's a big open door for now when the FDA meets on Friday stateside, so early Saturday for us. They're going to review and make their full recommendation for whether or not to allow the Johnson & Johnson vaccine to have its full emergency use authorization. And so if they declare that, you're looking at potentially by next week, it having its full EUA early next week, I would say. And so again, the Johnson & Johnson's a single dose vaccine. And so how does that, and so we're going to have to start thinking about that once we get our own share of allotment of Johnson & Johnson. How are we going to utilize that? And ultimately now it's going to be that we have to give people a choice, right? And some people would still want to go with the 2 regimen of Moderna and Pfizer, and some may be just happy with the Johnson & Johnson. We have to figure out how to make that an equitable choice for people to have access to both, if what the supply is not the issue. And then the last thing I'll just say about the Johnson & Johnson is that they are ongoing trials right now to see if a second dose of the Johnson & Johnson would be beneficial, because the original studies was just for that single dose. And then you're looking at about over 70% effectiveness for that just single dose. But they're trying to see if they matched it something similar as the Moderna and Pfizer giving a second dose, could they get up to that 95 or so percent?
Doc, is there like a product review on the vaccines, or do you have an opinion on which is the best to worst, or are they all the same? From Pfizer to Moderna to the impending Johnson & Johnson?
It's hard to say right now. I think it's pretty straightforward that the 2-shot regimen, when you get up to 95% effectiveness, that's pretty good.
Right.
But see, what's happened here is that if this came reverse, if Johnson & Johnson came out first, we would have been ecstatic about having a 70% effectiveness.
Right.
Because anything above 50% was what the WHO said would actually help curb the pandemic. So, but now it's like the bar is so high because of what Moderna and Pfizer have done. Like Johnson & Johnson, even though it's extremely great what they have, it's still now not it's not the standard at this point. So, but that's why Johnson & Johnson's actually going to be good for a lot of areas. Oh, the other thing is that it can be stored in the refrigerator for like 3 months, I think.
Right.
It doesn't need to be frozen. That's it. So logistically, this is a very, very good, vaccine for a lot of hard to reach areas, for a lot of underserved areas. So that's something to keep in mind.
I wanted to ask, okay, yeah, Janela, we'll close with the testing, but I wanted to ask Doc before we let you go. I know I'd asked about people getting sick on the second shot, and you had said, oh, it was anecdotal, but I was able to see a few different posts on social media. I'm just going to read from them. Our friend F. Glenn, who's an avid Link Fam member, this was over the weekend. He had posted that his entire Friday was shot after he received the second dose on Thursday. Just rested all day, drinking lots of water and juice and taking Tylenol. Had body aches, headache, and chills, and feeling so tired with lower back pain. I was able to rest and go to a gathering in the evening, but still feeling a bit uncomfortable. And then on Saturday, I woke up feeling way better. Lower back still hurts, but nothing a little Tylenol can't fix. Then my friends Chris and Valerie had posted, I think I'm back to normal after that second vaccine dose. The fatigue got me the worst. I made it through without meds, just kept up with my ketone packets. The feeling of being hot inside, yet no fever, was odd. I can't remember when the last time I was that fatigued. Glad to be feeling some energy now. And then one of my other friends had posted on Twitter, low-key wish I didn't take the second vaccine because I've been having head and body aches, slight fever, chills for the past 10 hours. So is that kind of normal? I'm not freaking guys. I mean, you're going to get the second shot, get the second shot. Because if you don't get the second shot, then you got to wait a while, then start all over. So you definitely got to. But just so people know what to expect, is that pretty much run of the mill, or are these like just the freak cases?
No, well, so let's be clear that so about 4% of people after their second dose are going to have that fatigue, and about 2% are going to have that headache. And so, but they're the ones that are going to be vocal about it also, right? So they're the ones you're going to hear from. You don't, we've given over up to about 50,000 vaccine doses, close to it now. And so we're not hearing everybody's testimony about it. You're hearing a few of these. But I will say this, those who, for these individuals, I'm sorry you went through that. I know it was tough, but it's very clear that now your immune system is ready. It's ready to go if it sees COVID and actual COVID. And so that's an important part there. And then I also would say this, if they had symptoms that bad from the vaccine, if they actually got COVID, they'd probably be a whole lot worse. And so it's thinking about that in context and comparing it toward some other evils, so to speak. But good overall, good for them for going through it and getting that second vaccine and powering through. And now they're so much more ready at this point.
Hey, I wanted to ask. Okay, Janela, go ahead.
I just wanted to give you a little bit of balance there. When I got my vaccine, my symptoms from the first dose to the second dose were almost exactly the same. I just had the pain in where the shot was at on my left arm, and mild fatigue from the first dose to the second dose, exactly the same. I didn't get the fever, the chills. I still could get out of bed and, have a normal day. So, it really ranges from person to person. Right. And I actually thought, what's wrong with me? Why am I not getting the fever and chills and all that? I thought maybe it wasn't working. So I think it really ranges from person to person as well. And I don't know, maybe Dr. Cabrera can add to that. Yeah. So,
Doc, I wanted to ask before we let you go, and then Janela's going to touch on the testing. With the senators getting the vaccination, I had asked a couple of them, hey, what do you think about this? Should there have been a priority maybe given to more essential critical workers who interact with the public more, and they kind of like threw the vaccine council under the bus and said, "Oh, they're the ones that come up with the protocol. I don't know. You got to ask them." So, are you able to maybe give us a little insight into why the senators were bumped ahead of other people?
Well, one is that even with the age requirement at where it was only an inclusion of 6 people. Okay. And so the argument was pretty clear, is that it was continuity of government that was important in that aspect. And in fact, something I've been argued that call should have been made even earlier because of just the limited amount, but it wasn't for the whole legislative branch. But I will say this, we talk about a lot of other essential and critical, areas. Those in the phase 1B, for example, is that there are a lot of them are eligible already based on age. So the combine the risk of their work and the risk of their age, they can be vaccinated. So it's not like we're completely ignoring them as well. 55 is very young when you think about it, especially compared to what the rest of the nation, a lot of them are still at the 75 and above. So, when you think about that, it makes a big difference.
Right on. Okay, so you're basically saying that a vast majority of the senators had already met pre-existing criteria to receive the vaccine doses, and only 6 were vaccinated at the discretion of the vaccine council.
Well, they were given eligibility to get vaccinated. Whether or not they've gone through it, that's their personal choice. Right. And or whether or not they make that public, that's their personal choice. But the eligibility was given to them.
So go ahead, Janelle.
I wanted to point out too that it's not an uncommon practice, I think, in other jurisdictions where they give the same courtesy to state legislatures or elected officials for the same reason, for continuity of government.
Right. Doc, so what about like continuity of the regular people? Where are we with the vaccine, doses for, like we said, those, grocery store workers, all the people who really come into contact with a lot of people per day?
Well, that's exactly what I was speaking to in terms of the other critical and essential workers that are in phase 1B. And that includes grocery store clerks, gas station attendants, and so forth. In that a lot of them already are eligible just based on age, and so those at the highest risk in those industries can go and get their vaccine, and we recommend that they should go out and get the vaccine already now. And so part of what we're likely to be doing is just really reducing the age group in a serial fashion, and making more people eligible so that everybody in any industry can go out and get it based on age. And that's going to be the easiest way also to prove that you're eligible is age. So we're thinking about it both operationally and also by, and ease for, and making it the most simplistic, and not having to go through a lot of bureaucracy and trying to prove that you're a clerk at a gas station or what have you. And then where do you draw the line? Okay, you say grocery store. What about the stoppers? What about the security that's there? So you get into all these different things, and it gets way more complicated, and then makes people more hesitant to go out and get vaccinated because they don't want to be turned away. Yeah.
I think you just would open it up and say all retail workers come to UOG or whatever.
Yeah. So supply is also a big important part here. Right. For every 5 years age, we go down. So if we go down from 55 to 50, you're adding about 10,000 eligible people that could come out and get vaccinated. And as we just said earlier, we're going to be getting 35,000 additional shots early. And already, you have to remember, a big part of that is also for second doses for those that are due. And so already you're already looking at how big of an impact it could have on our supply based on how we open and how we move down the criteria.
Well, stand by real quick. Sorry. We're KUAM FM, Agotnia, Guam on the Breeze 93.9 to our viewers on KUAM TV. Thanks for jamming with us. Jump over on the radio, the Breeze. There's an audio stream, Docomo Channel 10, and of course our Facebook live feed on KUAM News' Facebook live page. My name's Chris. That's Sabrina banging on her laptop. Okay. KUAM TV. Esta. Adios. And we're back. Sabrina Salas Mantanani, good morning.
I wanted to follow up on something regarding adult daycare centers. Where are we in approving the reopening of those facilities?
Sabrina, I have to actually look into that. I know that we have been vaccinating the adult daycare centers. We've actually, we just went there yesterday, actually. And that was the third visit that we did with the adult daycare center. And I'm not sure if that third visit meant that we completed all of them for vaccination, because we're doing both the adult daycare, the patients that are there, the clients and their staff, the caregivers as well. But as far as reopening, that's something that I'll have to inquire with our team about and find out what the status is as far as reopening. Okay. But I can definitely get back to you on that.
Okay.
Thanks.
Any questions for Dr. Cabrera?
No, I think I sent all mine.
You did. Early. Thanks. Oh, I was just letting people think I thought of those.
Oh.
Yeah. Okay, Doc. I guess we can let you go. But Janela, you want to close on the testing and see you, Doc. Oh, Dr. Cabrera, before you go, I just want to say that I ran into your mom at Payless. And your mom said that this is her favorite show. And she's, I mean, I'm not even lying. You can ask your mom.
There's no endorsement from my mom. Wow.
Yeah. I don't know if it's your favorite show, but your mama loves this show. So
Well, she's wished him happy birthday before. She's sending birthday shout outs for Doc.
Yeah. Because I see her on the. I was like, is that? Yeah. So thank you, Mrs. Cabrera, for your kind words. She's really sweet. She's like, man, I love you guys. When I wake up, I always catch the show. You guys are my favorite. So there you go, Doc.
All right, thank you.
I'm gonna start going through your mom to get you on the show. Right. Okay. See you, Dr. Cabrera.
Bye, Doc.
Okay. Okay, Janela. You want to close on the testing? When's the testing? And
today.
Really today? Okay. Sorry. And really, if you could just kind of stress how important it is for people to go get their swabs.
Yeah, thanks, Chris. So we are having another community testing today, COVID-19 testing at Tiedzin Grounds in Tiedzin, Barrigada. It starts at 9, so in about 48 minutes. And so we're offering up to 200 tests. It starts at 9, ends at 12. So we are, again, just encouraging the community to come out. You can be from any village, don't have to have symptoms. And again, this is the antigen testing, the Binex Now. Very convenient testing. We will have results available on site. Takes about 15 minutes to get your results. Pain-free. It's not the PCR test that goes all the way up to the laryngeal. So it's a very convenient process. You're in and out of there, I would say, maybe 30 minutes. But just really want to encourage the community. One unique thing that we're starting now, every time we go into a village, I think last week we were in Jonya, this week we're in Tiedzin. Now we're passing out flyers just to kind of increase awareness in the village that we're in. So last week we had a really good turnout in Jonya, and we're hoping for a good turnout again this time in Tiedzin. But again, just encouraging the community to come out, take advantage of this. It's free. And we're seeing low number of cases. But that doesn't mean that, we need to let our guard down. So just encouraging the community to take advantage of this. It's free. We continue to hear from the community about where is the next testing, or when is the next testing. And of course, we have available testing when there's no mass testing going on. So we have our Northern Community Health Center. But whenever we have mass testing, take advantage of it. So just want to put that message out there, and I thank KOAM for giving us this opportunity.
Of course.
Always.
All right. Good?
Yes.
Okay, Janela. Thank you so much.
Thanks,
All right,
Janela.
take care, guys.
It's 8:14 on the link. Good morning. It's Thursday, February 25th. Coming up, Cover Me, brought to you by Burger King, where they have the BK Big Fish, which we had some of those the other morning. Mwah. Delicious. All right. Really good. Crispy. Not too heavy on the mayo or the tartar sauce. It was the bun. It was amazing. I mean, if some were to come our way tomorrow on a fishy Friday, I wouldn't even get mad. You know what I mean? I'd be like, okay, we can do that. But you can also do the Impossible Whopper, and that's vegan, right? It's impossibly. It's good. That's good. Joe Sir likes it. Joe Sir is allergic to vegetables, guys. So if he eats the Impossible Whopper, and
Joe Sir approved.
It's Joe Sir approved. The only vegetable he likes is rice. It's 8:14. We're gonna take a quick break, and we're coming back with.